Okay, good afternoon, everyone, and welcome to the PPI Network at UCD launch Fireside Chat. And it's a great pleasure to welcome you today. My name is Thilo Kroll, and together with Dr. Amadoris, I'm leading this initiative here at UCD. And just to give you a snapshot of background, what this is all about. So the national network at UCD is funded by the IRC and the HRB and involves 7 universities and many national international partners. And over the past 4 years, really, the HRB and IRC have ignited this process of patient and public involvement in health and social care research. And we had some initial successes to build relationships, resources, and supports around PPI. So in phase 2, we will be one of the key partners, one of these 7 universities that will be sharing resources and experiences across Ireland in partnership with our many partners around the country and internationally. But without further delay, it's now my great pleasure to introduce Professor Orla, who is our Vice Principal for Research, Innovation and Impact here at UCD. And Professor Feely has supported engaged research and patient and public involvement from the start and supported us along the way by making patient and public involvement and engaged research more visible, both at the strategic and operational level of the university, and also very practically in supporting us financially and co-funding, the important post of the PPI project manager and coordinator. So I will now, without further delay, hand over to Professor Feely to say a few words and to officially launch the National Network Phase 2 here at UCD.
Thanks very much, Thilo, and I'm delighted to be here. As you say, this is an area that I, really very strongly support at a personal level. I think it is so unquestionably the way that we have to go with our research into these areas that are under consideration here. And I've seen so many wonderful and imaginative projects coming out of this group within UCD over recent years. I remember a couple of years back, pre-COVID, being at a poster session where the posters were delivered by the patients and their families as opposed to by the researchers. And I thought, what a brilliant way to kind of flip our experience and how we share knowledge about these important questions. And again, I'm just so happy to be able to support it in whatever way I can. So as you say, Thilo, we are today launching the UCD leg of this national network phase 2 on public and patient involvement. It involves 9 higher education institutions, key national partners like the HE and TUSLA, NGOs, advocacy and charitable partner organizations, and local public and patient partners. So it's led by NUIG. It has 7 university sites as co-leads. That's ourselves, TCD, DCU, UCC, RCSI, UL, as well as NUIG, lots of acronyms there. It's funded by, as you said, the HRB and IRC, and each of the universities is putting in matched funding. And in an environment where, we don't have an awful lot of funding to cover off all the things we'd love to do, I think the fact that all the universities are putting in matching funding shows the importance that we all attach to this area and the possibilities that we see there. So what's up for grabs here is really transforming research in these areas, in broad health sciences and related areas. So I think that it's a huge prize and it has so many ramifications if we get this right, that it's so exciting that we are getting to work together, share best practice, and really put our energies behind this. This is something that has been emphasized as part of a wider University Engage network, and we have the Campus Engage network run out of the IUA. So this is something that across many domains we see as being enormously important to us. And again, one of the reasons that we're so happy to support it. So we've lots going on. It's to do with our research, it's to do with our training and our education. The UCD Research Office is a core partner here, as you know, and we are delighted to be so. And we really want to continue to support you in every way we possibly can. There's so many wonderful stories of success in this area. And I know you've been sharing some of them already today, and you'll be sharing some more. I know that what you are seeking to do through the network is to give very practical advice to people as to how they can get involved and how they can do better work around public and patient involvement and the benefits that are to be derived. And I know that part of what you're doing is giving a voice to communities that are too often not heard in our deliberations around health more broadly, and in particular around research and education in health. These would be patients themselves, of course, patients in rare diseases and their families, people who are homeless, people with disabilities. And we want to make sure that all those voices are heard and amplified in what we are doing in our work here. And the benefits ultimately would be to make research more accountable to the public, to make research more meaningful in addressing the needs of the public and patients, to make research better in learning about how research approaches can work best in these contexts, and to make research more impactful, to make sure that the work that we do is landing out with all these groups in the best possible way. And I think that the current situation of the pandemic, and of course we always have to say it's such a shame that we can't be in a room. You could imagine a really creative session workshopping and that around all these ideas would be great. COVID has highlighted the need for public and patient involvement and really strong communication bilaterally around areas around health sciences and related sciences. So we really understand more than ever before the need for this type of approach, but it has also thrown up practical difficulties in conducting research that involves patient involvement. Just even interviews and so on are that bit more difficult than they would have been previously. So there's loads and loads of questions to probe here, loads of best practice to be shared. I'm delighted we in UCD are so involved in this, and I want to continue that involvement. Thanks to Thilo, thanks to Emma, thanks to Amanda, my colleague Liam Clear in UCD Research, all those who are so involved in driving this agenda in UCD and nationally, and increasingly, I think, internationally. And I really look forward to seeing what we can deliver together on this. So Thilo, I'll hand back to you now. Thank you.
Thank you very much for those kind words and encouraging words, Orla, and for your support. So we have a very interesting and packed agenda actually this afternoon, and hopefully some very interesting discussions. So I will now hand over to Professor Amanda McCann, who herself has been very instrumental in driving a lot of patient and public involvement in the area of cancer specifically, and has launched and developed a few years ago sort of a patient voice initiative that has now really grown beyond UCD into an all-Ireland approach, and has been very successful, and has placed really patients and their families at the heart of decision-making and of research. So, so Amanda, thank you very much for facilitating the afternoon.
Lovely, thank you very much, Thilo. And yes, I was delighted to be asked to be the facilitator for this afternoon session. So my very first lovely job is to introduce our four panelists. So our first panelist is Professor Thilo Crowl. Thilo is the UCD lead for the HRB funded National Network on Public and Patient Involvement in Health and Social Care Research. Thilo has carried out social and health-related research in various health systems and care environments in the United States, the United Kingdom, Germany, and Scandinavia. And his background in psychology has led to a variety of interdisciplinary research studies, combining quantitative and qualitative research methods with a particular emphasis on inclusive research designs for otherwise marginalized groups. Our second panelist is Les Martin. Les is a chartered engineer and father of three. Two of his sons were diagnosed with the rare disease metachromatic leukodystrophy. Les campaigns for an expanded newborn screening program in Ireland. He has also been involved with research into rare diseases and has experience as a PPI contributor for rare disease research in Ireland. Our third panelist is Professor Suzanne Guerin. Suzanne is Professor of Research Design and Analysis and is head of the school at the UCD School of Psychology. Her main interests are in health services research with a specific focus on palliative care and intellectual disability. She is a member and vice chair of the All Ireland Institute for Hospice and Palliative Care Research Network. Our final and fourth panelist is Dr. Nikki Dunn. Nikki joined Family Carers Ireland in March 2019. Family Carers, to put it in context, is the national charity supporting the 500,000 family carers across the country who care for loved ones, such as children of adults with physical or intellectual disabilities, frail older people, those with palliative care needs, or those living with chronic illnesses, mental ill health, or addiction. As the organisation's research officer, Nikki leads the Family Carers Ireland's programme of research and manages a diverse range of both qualitative and quantitative projects relating to family carers. So we have an exceptional panel, and what we asked them to do was that we were going to go slide free, and that they would give us a 3 to 4 minute overview of their experience with PPI to date and how they have interacted with UCD via Ignite or otherwise. So we very much look forward to their presentations, and following that, we'll have a Q&A, and we would encourage you to put questions through the chat as you see fit, and we hope to get to many of those following that. So I'm delighted to start with Thilo, if you would like to give us your slide free 3 to 4 minute fireside chat.
Slide free. Well, so there's an opportunity to tell stories, which is nice, and I enjoy the slide free approach. So so thanks for the introduction, Amanda. So my initial experience with PPI dates back actually to a very personal experience. When I was in my teens, I was diagnosed with rheumatoid arthritis, and it was now I'm dating myself, so it was in the 1980s, and young people with arthritis didn't have a voice in their care nor in research. And so we decided actually as a result to form our own advocacy movement, and it started started in my native Germany, but parallel, it started in many other countries around Europe. And we came together in 1989 as the first International Youth Conference, and we led the agenda, and we invited researchers to that. And since I have been employed as a contract researcher by arthritis organizations who were in charge of the research agenda, and I brought my research expertise as it was growing to those organizations in the UK and in Norway. And then from there on, Amanda, you said, I have a degree in psychology, I moved into the area of applied health sciences and health research, and moved from a little bit from country to country. And so I give you sort of a little bit of a snapshot of things that I've been involved in. The US, we co-designed and evaluated a peer support program with young people with violently acquired spinal injuries in the context of a rehab setting. So they had gunshot wounds, and there was a completely marginalized population. They were not often considered by the health professionals as a priority group. And we wanted to enhance the community support and community outreach. In Scotland, I worked with Action on Hearing Loss and a site action charity to understand older people's access to community pharmacy services. And we co-designed sort of the research process with them to really make it accessible and inclusive for people with sight loss and hearing loss, and to understand their experiences with community pharmacy provision. And here in Ireland, I've worked, with people who were homeless, and also with Les is on the call here, and he will talk a bit more about the rare disease area. So how we can understand those research experiences and develop inclusive research design and methods that are appropriate and meaningful to people involved. So, and as you said, I've been leading the PPI Ignite program here at the UCD over the past few years. But this is a partnership approach. This is a collaborative approach with many other people, around the table, and especially with our community and patient and public partners. So I think I stopped there. Hopefully that's within the 4 minutes.
Pilo, absolutely perfect, and thank you very much for that. So may I ask Les if you'd like to share with us 3 to 4 minutes?
It doesn't fit into that small of a nutshell now, unfortunately. But yeah, my name's Les Martin. I'm a dad of 3, and two of my boys have a rare condition, metachromatic leukodystrophy. Unfortunately, Cathal, my oldest boy, passed away about a year ago, age 6, after those 6 years of illness. But my younger boy Kieran, he's 5 now, and at the age of 1, he received a trial gene therapy in Italy, and has more or less been saved by that therapy. His course would have been the same as his brother's, if not for that treatment. But happily, he's attending school now, and he's very well and stable. But it was, we traveled to Italy for his treatment, and it was through our experience there, almost a year there, that I learned of their newborn screening program. And I returned here to Ireland to, when we returned to Ireland, I began to campaign for an expansion of our current newborn screening program, which is, according to international standards, weak or inadequate. And the Italian model had just recently been revised. So that was the thrust of my campaign, and that campaign has been reasonably successful over the course of the last few years. And as a result of it, I suppose, and at the moment, I should mention it, there's an open call currently for submissions to the National Screening Advisory Authority or committee to make proposals for any new conditions that should be included in any of our screening programs. That's a public call, and it's open until the 23rd of December. But that is the point to which that campaign is reached, and I hope to see an expansion in that program next year. And it was over the course of that campaign that I became involved and came into contact with the rare disease community at large, which spans obviously a huge amount of conditions, but there's a core group there who advocate and work on behalf of the rare disease agenda and furthering it, some of whom from UCD. And through that connection, as Thilo said, I've been involved in a couple of projects and research applications with UCD by invitation and through the work that we had been involved in. And for me, it happened very naturally. I just followed my nose, and this is where it's ended up. And I'm really delighted to have been invited here. I've seen the good that the cooperation that I've been involved in with UCD and others in the advocacy world, what good can come from that. And look, yeah, as I said, I'm really proud to be here. I'm also trained or a chartered engineer, and I did my degree in UCD and a postgrad in education in UCD. So I'm super proud that you guys are leading this particular initiative, and I hope that it will, as you described in the opening statement, Orla, come to pass and bring forward a new sort of era in this sort of paradigm shift towards involving the patients not as subjects or subject matter or a data set, as leaders and as stakeholders and as beneficiaries. And in my world, on a building site, they should, in my view, they should be like the client, you know, and what we can as a body of people, carers and families and parents, what they can bring to the table. There's some really capable and fantastic people out there who are motivated by improving their own lot, that can really contribute. That's it, I think.
Les, that's amazing, and such an incredible contribution you continue to make. And I think this whole issue around shared decision making and shared research making, you know, just complete involvement and not having a sort of a separate entity is absolutely crucial. Wonderful. Okay, Susie, you're next.
Thanks, Amanda. It's really interesting listening to Thilo and Les talk about their involvement. I've been reflecting about my own exposure to and experience with PPI over my career, and I realized actually that it goes back in some ways informally to some of my earliest experiences as a researcher. As Amanda mentioned, one of my main areas of research is health services research, but as a very young researcher starting my PhD, I was really interested in studying the phenomenon of bullying in primary school, but I was very interested in what pupils thought about this issue. And at the time, there was lots of literature on how bullying was defined, but it was all from an adult perspective. And there were very few studies that actually talked to young people about how they defined the behavior. So I was very keen to sort of understand it from their perspective. But I remember at the time feeling very unsure of how to write an information sheet. And I reached out to the only resource I had at the time back in the 1990s, when PPI was not the same thing. And I asked my mum to help me write the information letter for parents. I felt that she had much more experience as a parent of children in school. And she helped me to prepare that document in a way that would, I suppose, speak to parents about why I was doing this study. So that was my very, very first experience of seeking that expertise. I was very lucky in my PhD to work directly with groups of pupils in schools, and in one phase actually worked with two amazing groups of students to design an anti-bullying intervention for their school. So there was this sort of automatic sense in me that I needed their expertise in order to be able to do my PhD to its most effective level. But that was very, I suppose, instinctual rather than something that I planned to do. I think thinking into the later part of my career as I finished my PhD, definitely moving into the areas of intellectual disability and palliative care research, I've learned a huge amount about working collaboratively with individuals experiencing disability and experiencing serious illness. I'm very lucky to work with colleagues in St. Michael's House, which has an amazing information transformers group of self-advocates who advise staff within the organisation on making sure that questions are being asked in an inclusive and meaningful way. And in the palliative care area, I'm very lucky to work with the Voices for Care Users and Carers Forum within the Institute for Hospice and Palliative Care. And in all of those things, my interest as a researcher is in answering questions that are meaningful to the people who are affected by them, and using, my knowledge of methodology to ask those questions rigorously and effectively so that they can be positioned to have an influence. But I think it's through engaging with patients and carers and others that actually I've learned the most about making sure that the research that I'm doing is grounded and in a position to best amplify the voice of those groups. I sort of see myself as being the megaphone, but not the source or the audience for the information. So I've been really shaped by my experience of engaging with individuals experiencing disability, illness, and other areas. And it feels very natural to me to do it. But it's been great over the course of my career to see PPI develop as an expectation, a meaningful and strongly delivered expectation for researchers.
Susie, how lovely is that? I made notes here, amplify the voice, and you're now saying that you're a megaphone. Amazing.
My husband would say I'm a megaphone for different reasons, but
well, that's not the purpose of our discussion this afternoon, Susie. So we'll move on. Nikki, our fourth participant. So would you like to share with us your 3 to 4 minutes?
I will. Thank you so much to everybody who's already spoken. It's quite inspiring to hear about all the different work that's going on. So just to give you a bit of background, I guess, to myself, I'm a sociologist by training, so I think I'm really influenced by participatory research approaches more generally. So when I joined Family Carers Ireland nearly 3 years ago and started to see, actually when I first started 3 years ago, what I found was we were being asked for support with recruitment to different research projects for family carers to be involved. In terms of responding to surveys, being interviewed, and so on. And over the course of the 3 years, I really started to see an increase in requests for PPI support from researchers. And I began to see the value of actually having a panel of family carers within Family Carers Ireland who have training in research and PPI, and that they're not just involved in one-off projects, but that they can take their experience as PPI contributors into multiple projects, but also back into the organisation in the sense that they would be able to share their experiences with other family carers as well. So this was a thought that I had there about a year and a half ago, and I broached the subject with Aideen Mihai and Deirdre O'Donnell and PPI Ignite, and they really supported the work, kind of introduced me to different models of a PPI panel within a charitable organisation. And they were just a really good sounding board, and just encouraged me and gave me the confidence to just kind of go ahead and set something like this up within Family Carers Ireland. So we set up a small group last year, about 18 months ago. So right in the middle of COVID. So it's a small group. There's about 6 people on it. And that's sometimes, there's other people actually that are involved in as PPI contributors that aren't necessarily part of this group as well. But so UCD Ignite supported us in delivering training on what PPI is to the group, so that they had some sort of a grasp around the difference between involvement, engagement and participation, and they really found that important. UCD have also supported, the PPI Ignite team have also supported us delivering sessions on research methods for the group. And we've also had a carer who has come in to talk to the group, somebody who has quite a lot of experience and involvement, and she's come in to talk about the highs and lows of PPI, really. What are the challenges when you're a PPI contributor and a carer. And I think that was really good for the carers in the PPI panel to have their eyes really open to some of the challenges and the pitfalls, as well as the more positive experiences. So the group are currently working on a number of different projects as co-researchers. They're sitting on advisory boards and committees and so on. And they are, as Les said earlier on, they're bringing a lot to the table. The feedback from the researchers on the group is really good as well. They're getting a lot out of what the carers who are involved are actually bringing to the research. We've only had one person who's had a conversation with a research prior to the development of a grant proposal, though. So there hasn't really been a huge amount of involvement at that pre-commencement stage yet. And that's something that I'd be kind of pushing for, I guess, early next year, and trying to think about how we can encourage those early conversations. It's also worth mentioning that we were really lucky to receive some seed funding from UCD, PPI Ignite, for a piece of qualitative research, which we worked. It was basically following on from a survey that we conducted in partnership with Deirdre O'Donnell at the UCD School of Nursing and Midwifery on carer health and wellbeing. We knew that travellers who had care and responsibilities weren't represented in that sample, and we really wanted to think about how we were going to deliver supports and services for the travelling community who have care and responsibilities as well. It's not a group that Family Carers Ireland have a lot of understanding about our connections with. So the seed funding allowed for really, I guess, relationships to start to develop, and we were in the process of, I guess, doing all that relationship building that's so important to PPI when COVID hit, and that really hampered the project then. But I think regardless of that we were kind of stopped in our tracks, there's a lot of learnings from that piece of research that are relevant to the conversations here today. And I think actually I was on a call earlier on with UCC on carer engagement and involvement in research, and what really came out of the discussions there, I think, was around the importance of relationships as well when doing this type of work. And what really came out of the work, and actually all of the work to date that I've been involved with regards to PPI or any research really, is relationships and mutual respect, sharing, listening, dialogue, building collaborative relationships that are rooted in trust and reciprocity. It's not easy to do all these things, they do take an awful lot of time. And I think that's one of the things that everybody has to be really conscious of when doing this type of work. It does take a considerable amount of time to build up trust and develop relationships, and that can't be underestimated. But I don't think you can do meaningful PPI without that type of work, and also not to see relationships kind of project bound, but also see them beyond the context of a single research project. as well. So that's just to conclude. Then I think working with UCD Ignite has been really critical to the development of our own PPI activities within Family Carers Ireland. They've been so supportive, and we are really looking forward to continuing that work that's been done to date so far. Thank you.
Nikki, that's incredible, and that term relationship came up in the discussions earlier today, and the fact that, as you've rightly said, that won't happen in 24 hours before a grant deadline. That it has to be something that develops over time, and that one gets to know the partners that one's going to work with in relation to pushing the research agenda to make it as impactful as possible. So I think, you know, we've all come across situations where, you know, something has to happen really quickly, and for this to really work, there has to be that lead-in time to build that relationship. So just to very much reiterate that. Wonderful. So thank you to the four of you for your 4-minute contribution. Emma, I know, is there in the background. I have maybe a question that we could start with, and then we can have a look at what's coming through the chat. So my first question, if Nikki and Thilo might like to think about this one, what are the key areas you have seen improvement in since the establishment of the first PPI Ignite? So we're in our second round now. So what have you seen as key areas for that have seen improvement? Thilo has a big smile on his face, so we're going to hear a lot of positive things here now.
It's all positive. So I think, so we're on a journey, and I think that journey didn't start with PPI Ignite, because I think what we're finding out is that actually, because the name that is being used in terms of you know, community engagement, citizen engagement, participatory research, I think there's huge expertise, you know, dotted around the university, you know, that perhaps would not identify necessarily as PPI, but we obviously is very similar. So we've seen, I think, over the course of the last round of the phase 1 of funding, actually a number of things happening. And Orla touched on those as well. I think it wouldn't have happened without the support of the university senior management, you know, in terms of establishing a community of practice on public, we call it PPI, public engagement across the university. We've seen over 150 people across the university signing up to the mailing list, and that's growing, that number is growing. We have established sort of a shared definition and a framework for engaged research, and that had the buy-in of researchers from across the university, and it has been vetted really by the public as well, in the context of a science festival where people could leave comments and engage with that definition and that framework. We developed planning tools for PPI. This what we call the PPI Planning Canvas, which walks through the research process very systematically, what to think about, you know, when engaging in PPI, and those are resources that are available to anyone who's starting a research project. We have cost calculators developed to look at the budgets for PPI. Perhaps very successful was also the implementation of the notion of PPI and engagement activities in the career development framework, and also into the research management system. And we have metrics now, and we can show and demonstrate what form and type of PPI and engagement, you know, is available. And we've had really successful conversations with really key entities and at UCD. So obviously we're working very closely with UCD Research, the Research Innovation and Impact Office. But beyond that, we've had very good working conversations with UCD Finance, UCD Human Resources, UCD Ethics, UCD Estates, about a range of issues from, you know, reimbursement to employment contracts, ethics applications, and the accessibility of venues and buildings, you know. And so I think those are just some of the internally focused ones. And then obviously, you know, as Nikki has alluded to already, sort of we've worked very in very positive ways, and also with less, input with our partners on a number of research projects, and that number is increasing, and those initiatives are increasing over time. So,
thank you for that, and it came in the discussions earlier today that people are very happy about the RMS now being something that we can populate. It's been very much acknowledged the importance of having our colleagues involved with PPI, but also it's a way of sort of looking at, the wealth of PPI interest and participation within the university. Nikki, would you like to contribute anything else to that?
Yeah, I would actually. Thanks, Amanda. So I guess we're definitely getting less and less of the last minute requests for support. So when I started, and I know for my colleagues beforehand, we had a constant stream of researchers getting in touch the evening before a grant was due, asking us to be a collaborator or to find a carer. And, it was just like any carer, doesn't matter. And, it wasn't very respectful, I guess. But I think the PPI Ignite, whether it's the training that's going on and the awareness of how appropriate it is to approach like a PPI contributor or a charitable organization, it is giving us a bit of a mandate to push back against this and say, actually, that's, you need to get in touch with us a bit sooner than that, or to ask more questions. So yeah, I think we are seeing less and less of those kind of last minute requests, and researchers getting in touch with us much earlier and actually asking us about what's appropriate, what can they expect from us as an organization, what's appropriate to ask carers. And we'll always say, well, you need to ask carers themselves and the people that you might be involved in the project, what's appropriate for them. But yeah, I think there's definitely just acknowledgement of the workload within charities as well. So like, I'm the only research person within Family Carers Ireland, and so researchers increasingly ask us, could you sit on this committee? Could you meet 3 to 4 times a year? So there just is a bit more acknowledgement of our time in applications as well. We also we are seeing carers coming on board as co-applicants and collaborators in research projects as well. I have seen an increase in that over the last couple of years. And as Thilo suggested as well, we're definitely seeing a culture where reimbursement or financial compensation, the recognition that needs to happen is increasingly becoming the norm. It can be an uncomfortable subject, but I definitely bring it up in all the discussions that we have with researchers about carer involvement, how are PPI contributors included in the budget, how is, if somebody needs to substitute a replacement care costs, are they going to be included in the budget? And what I've seen is a huge appetite amongst researchers to include all of these costs in the budgets. But the problem is, I guess, there's the joined up dots between finance and all of the other things that go on within the institution, and then the wider kind of policy context, social welfare, the Department of Social Protection, like all of those dots haven't been joined up yet. But I know that that's something that is being worked on behind the scenes as part of the wider UCD Ignite. So I'll leave it there.
Can I just, to the last point, Amanda, can I just say that's something that's explicitly part of our current work, that national network now, so that we're leading actually together with RCSI, this work package about those aspects of embedding it into practice and policies, and hopefully we'll see at the end a more uniform approach, irrespective of which university you're working with, in terms of that there's that recognition of what needs to be done in terms of, reimbursement and recognizing the diversity of situations and constellations you might have.
Wonderful. I see 1 or 2 questions coming through the Q&A, but I think I might just ask this question and maybe see if Les would like to comment on this. What motivates you to work towards changing the research culture via patient and public involvement in research?
Well, I think what motivates me to do any work in this area is the fact by default that that I will continue to be involved and to continue to be a subject and a beneficiary of this research, whatever it may be, into the future. What I mean by that is my son Kieran, he will always have a rare disease. He will require all the services that are the subject of the research that I've been involved in. And therefore, I'm protecting his interest into the future, but that sounds selfish. It's not just for his interest, but really what motivates me as well. I already mentioned about poor Croll, and he passed away a year ago, and having borne witness to, you know, what an illness like that can be, it was distressing and upsetting to the extreme for myself, and I feel a sort of sense of obligation to use my voice to protect some other poor unfortunate of the future from the same fate. And I feel at times, you know, that sense of obligation, you know, that I must act. I have to continue on the course, because it can be very frustrating, can be exhausting. As I said, the home life can be difficult to juggle and try and concentrate on projects. And it was mentioned already that carers can feel like this could be a burden to them or whatever, to be involved in research projects. But really, I'll continue to be involved in this, and it's for my son's benefit, and for those that I've seen, you know, I saw what Croll's life was like, and I want to protect others from that. And so it's very heartfelt and personal for me. Also through my experience, and it happened by chance and very naturally to become involved with Thilo and Suzanne in UCD, but I saw the great work that we did together, and I was really encouraged by that, and more than it feeling like a burden to me, you know, I was encouraged and really felt like we were making progress, and I feel like we still are, and we'll continue to do so, working collaboratively like we have done. And as I mentioned, through all my contacts in the rare disease world, other fantastic parents, and how much I've seen them do on their own, and they again provide continuity from one research program to another. They'll always be involved, and that is the way that I would like a sort of continuous progression of those people key in the rare disease world and other areas to move with this research from project to project and into the future.
So Les, you are an incredible voice, and when we met the first time, we were chatting about grant applications and, you know, your absolute involvement in those. So your co-applicants, I mean, this is exactly the way the shared decision process around research strategies, that's the way it has to be moving forward. So you're incredible, having the tenacity to stay with these grant applications. And again, as we said the first time we met, one just has to take deep breaths and keep applying and keep applying. So you are doing so much. Okay, before I direct a question to Susie, let's see, Liam Gallagher has asked a question. How do we ensure that patients or the family representatives are not taken advantage of in terms of tokenism? Can I open that to the panel? I mean, it's got something to do with building a relationship and not asking for something 5 hours before a grant deadline. That's just not going to work. Any other comments from the panel for Liam? Yeah, Susie, lovely. Thank you.
I think I'd go back to something that Nikki said, which is if you really recognize as a researcher the limits of your own experience and knowledge and the complementary expertise and knowledge that parents, patients, carers have, and you start from a point that even in developing a project, you need to have that complementary expertise and knowledge, I think you're more likely to do that in the most meaningful of ways, which is that the questions being asked are driven by those groups, not just how you're going to answer those questions or how you're going to reach that particular group. I think if it's inbuilt from the very beginning, it's much more likely to be meaningful because it is co-produced. The agenda is set by those who have an interest in it. you know, a researcher who doesn't have personal experience of a phenomenon can still meaningfully research that phenomenon, but their approach to it is complemented and strengthened by that. So I think a key thing is starting from the very earliest stages and working with those experts along the way.
Susie, I think that that's perfect. And also, when you listen to the feedback from patients who are now sitting on grant review panels, it absolutely is so apparent when something has been put there in the last couple of hours. You know, it is so readily identifiable. So it's key from the very start of things that, you know, there's complete involvement there. So super. Susie, thank you for that. Okay, I suppose the last question from me, and we'll see what comes through the Q&A. I'm just conscious of time here as well. Now that we're sort of moving into the next tranche of the HRB Ignite, and this is directed to Susie. What areas would you really like to see evolved or improved through this 5-year round of funding? That's going to bring us now to 2026. No pressure, Susie, but we're recording this.
Well, I mean, I almost feel like repeating myself, because I think the significant awareness has been raised amongst researchers about the importance and contribution of PPI. And I think the resources that Thilo mentioned and Emma has been sharing in the chat show that there is guidance and training opportunities there about how to do that well. But I think actually creating structures that bring members of those communities and researchers together, not for a project, but to discuss priorities, priority setting exercises in key areas, allow a better understanding of the capacity to work together. I think I would also come back to the point raised by several people. We just have to have a meaningful and appropriate framework to reimburse people who are contributing their time through PPI in a way that doesn't create difficulties from an employment perspective, a tax perspective, an entitlements perspective. You know, when any organization is set up, it sets up its payroll and its salary systems. I think we need systems that recognize that this is an essential feature and function of research, and that can be done in a way that is appropriate and efficient. I think we've all had the experiences of having to apologize to collaborators because there's been delays in processing payments or finding a way to give them vouchers to thank them for their time. So I think, again, creating the structures from the beginning to co-create the research agenda, and then also removing this unnecessary potentially disrespectful gate or barrier to meaningfully and appropriately recognizing the contribution that those groups give.
Wonderful, Susie. Okay, so Liam had another comment through the Q&A, and then I will be relying on Emma to come out and say we have to stop here now, because my God, it's now 10:04. But Liam mentioned, how do we envisage PPI activities being supported on the ground? Certainly training of researchers in this area is great, but actual budget to properly resource PPI activities is key. How do we mainstream? I think Susie has addressed that in her comments. If I could just, and it was something I was thinking about from the discussions this morning, and it's something myself and Thilo and Emma have discussed, trying to get PPI within our curriculum, or curricula, I should say, so that it's not something that suddenly hits, you know, that our medical students, our allied healthcare professionals, that it's part of the curriculum. And indeed within the postgraduate training, you know, you could have a lovely sort of longitudinal exposure to PPI for masters and PhD students, where at the beginning in year 1, what is PPI? Year 2, you know, buddying up, finding somebody that you could work with, and then you apply for grants. So you could see a lovely longitudinal story there. So I think that's something we need to to think about. Okay, now Emma, you see, Emma and myself are having this conversation here. So finally, just invite our panelists to maybe give a very, very brief summation, and then I'll close the session for us. So with Thilo.
Yeah, I keep it brief. So it was a very, very good discussion. So and very exciting, and very good to hear from everyone, sort of how they started thinking, experiencing PPI, and how they see it developing. So I think this is the main view that I have. I think for myself is that that's an evolving journey. So it's something that doesn't come to a fixed endpoint, and that we're continuously refining not only the processes and practices, but also that we have this learning, you know, that this openness to learn from one another, to really question, you know, what we're doing and to improving that. And so I don't think PPI or PPIE is rocket science, you know, but it requires sort of this commitment and dedication, requires flexibility and openness, honesty, trust building, and these relationships, you know, that don't develop instantly. So it's not rocket science, but it's like with any relationship, you want to build it onto solid, transparent, and good ground. And what I would love to see the future, that we have greater diversity of PPI as well, that it doesn't become an elitist exercise, you know, but it becomes something that is including really any member of the public, you know, and patients, so that we get a diverse set of voices and views and experiences included.
Absolutely. Would any of our other panelists, you don't have to, but if there's anything that you'd like to say as we finish? Okay. So it just remains for me to thank Orla Feely for her continued contribution and support for this initiative. And we heard from her words how, you know, how much she is there to try and really make sure that we can progress this. I'd like to very much thank our 4 panelists for your time. We had a pre-meeting last week, and it was lovely to meet you all, and also all of our attendees who were there for our fireside chat. Thank you very much for staying with us. Just to say that the document that Emma and Pilo have put together has a wonderful list of attendee resources, so I would encourage you to have a look at that. That should have been emailed to all of you. And my final thanks goes to Dr. Emma Doris, a wonderful friend and colleague of mine for many years. She is our Public and Patient Involvement Project Officer and Program Manager, and she worked incredibly hard to bring together the workshops this morning and to seamlessly make it easy for us and the panelists this afternoon. So Emma, thank you very much. I don't know whether you want to show your face to us. Has she gone? Oh, there she is. All right. So thank you all. And Emma, do we have to say anything else or no?
Thank you.
Sincere thanks to you, Amanda. Thank you very much to you for facilitating. Really do appreciate it, to you and all of our community across UCD, but really, really appreciate you facilitating this for us today, for all the panelists for joining us and the attendees as well for taking the time out to listen to us. Thank you all so much.
Thanks,
Look after
Emma.
yourselves and good luck with all your preparations for the festive period. We'll do our best despite NEFIT.
Thank you.